So what should a psoriatic arthritis patient expect you, the physician, to do, if not at every visit, almost every visit?
The first thing that we do is we really need to understand a patient's symptoms. So we should be asking about how much pain you've been having and how things have been since the last visit. And then we need to be examining the joints because we need to know how much swelling is in the joints because the goal of our treatment is to eliminate the swelling. And then there's the skin part. So we're not dermatologists, so we may not do a detailed dermatological exam or quantifying how much of the skin is affected by the psoriasis. But we need to know if the psoriasis is well controlled or not because some of our treatment will improve both the skin and the joints. So we may increase treatment for either the joints or the skin.
Why is it important for me to really be clear about the symptoms I'm experiencing or not?
What establishes priorities for changing treatment, if you're not able to do the most important things in your life, that's a good reason for changing treatment. My goal is to make sure that you can do the things that matter to you in your life, but I need to know how that's been going.
Right. So what are some things that prevent patients from being more involved in their care?
I presume that part of it is how comfortable they are in the relationship with their physician. And sometimes also there can be even some denial. So, patients have to be honest with themselves about how they're doing.
Yeah. So in general then, what is your goal as a physician, your main goal in treating psoriatic arthritis?
So the ultimate goal is, as you mentioned, but how do we get there? I think physicians tend to focus a lot on wanting to look at the objective signs of inflammation and making sure that we get rid of the inflammation, because it's the inflammation that's the key to everything else. It's the inflammation that gives the pain, the fatigue, the symptoms to the patient. It's the inflammation that causes the damage to the joints. So I want to make sure that we eradicate or completely get rid of the inflammation. So things like making sure that on exam there's no swelling in the joints. It's also about your symptoms. So making sure that ideally that you have no pain, and if I can't achieve the ideal of zero pain, at least little pain that doesn't interfere with you being able to do your daily activities and the things that matter to you.
So I'm going to make a big assumption here that that's a treatment plan. So
Yes.
it's the treatment plan that gets you to whatever the ultimate state of the disease is. Hopefully it's almost non-existent.
And my other goal is making sure that there's not going to be any damage to the joint and any progression of the disease. So I'm also looking forward.
Right. So describe just fundamentally what a treatment plan is.
Probably the central element to a treatment plan is the medications, because that's what we know can really make a difference in terms of controlling the inflammation and preventing damage to the joints. But there's a lot more to a treatment plan than just the medications. There's also everything else that a person does to take care of their health. So it's exercising regularly, because exercise is really important, and often patients are afraid of exercising. They're afraid of making their arthritis worse or damaging their joint, or they don't know what they can do. There's the general self-care about your emotional well-being, about making sure you take care of yourself, that you rest, and it's all the healthy lifestyle,
So
like
eating,
the diet,
balanced diet,
like the diet, the sleep, the stopping smoking if you're a smoker, all those things.
Yeah.